So the spleen is actually fairly interesting. Its function in life is two things, particularly at my age, middle age. It's primarily a filter for blood. The spleen sees the blood pass through. It identifies the old red blood cells, the cells that aren't carrying oxygen so well anymore, and essentially marks them for recycling. And red cells that are recycled are actually turned into bile by the liver and stored in the gallbladder and used to help digest fat. And after they help to digest fat, the intestine takes them back in, they get broken down and recycled again. So the spleen essentially filters our blood and keeps the old blood recycled so that our blood still functions well. Earlier in life, the spleen functions as an immune organ as well. So it is also sampling blood, but it's sampling blood for essentially invaders. And it learns the shape of invaders and stores that knowledge for some future invasion that allows us to amplify the components of our immune system that will attack the invaders, which are usually bacteria or viruses. So that's what the spleen does. The fact that the spleen sees a lot of blood is downfall in terms of serious trauma. When people are struck on the left side of their abdomen hard, they can frequently injure their spleen. The spleen can be injured in a lot of ways. It can just be a bruise, or it can essentially be crushed. And what we do kind of depends on how badly the spleen is injured. All in all, it's very much better for people that still have their spleens than not, both because it's better to have your blood effectively filtered, and it is better to have the immune function that a mature spleen still does have. But fortunately, if your spleen is irreparably injured and we have to take it out, you can still lead a full and active life, although we will have to give you a few vaccines to make up the difference in its immune function. Now, having said that, we really don't take out spleens a lot anymore. We found over the years that the spleens are a lot tougher than we thought, and their ability to regenerate and restore themselves to their full function is actually quite remarkable. So it's really only if the spleen is injured to such an extent that it's causing people to not be able to maintain their blood pressure. In essence, they're actually bleeding from their spleen in an uncontrolled way that we take out spleens. The rest of the time, we get people through and send them on their way with a normal, happy, healthy spleen.